The battle over vaccine access is heating up just as flu season looms, and Maryland is stepping up to fiercely defend the right of its residents to get vaccinated. While several states are debating whether to drop vaccine mandates altogether, Maryland is taking a clear stand to ensure everyone in the state can easily obtain vaccines to protect themselves against flu and other infectious diseases. In Maryland, residents have the option to visit their healthcare providers or local pharmacies to receive vaccines. They can also get expert guidance on which vaccines are most appropriate to shield themselves from seasonal viruses and potential health threats. This proactive approach is especially important considering the Centers for Disease Control and Prevention, CDC, recommends that everyone aged 6 years and older should get a flu shot annually. Adding another layer of complexity, the Food and Drug Administration, FDA, recently approved updated COVID-19 vaccines developed by Pfizer, Moderna, and Novavax. However, these newly authorized shots come with certain restrictions, as they are recommended primarily for adults and children who have at least one high-risk health condition. But here's where it gets controversial. Some argue that these limitations might cause confusion or reduce vaccine uptake among vulnerable groups. Maryland Governor Wes Moore expressed strong concerns about the federal government's shifting and, in his view, unnecessarily chaotic vaccine policies. According to Moore, such unpredictability could have dire consequences for public health, not only in Maryland, but across the United States. He criticized the confusing messages and policy changes, emphasizing that they undermine trust and hinder efforts to protect communities. Moreover, Moore highlighted the challenges Maryland faces due to federal vaccine guidance changes, especially with U.S. Health Secretary Robert F. Kennedy Jr. actively pushing anti-vaccine agendas that could jeopardize vaccine access. In response, Maryland took a bold step in 2024 by enacting legislation allowing pharmacists to administer COVID-19 and flu vaccines to anyone aged 3 and above without requiring a doctor's prescription. This move aims to make vaccines more accessible, particularly for young children and busy families. Governor Moore underscored that protecting the health and safety of Maryland residents and their loved ones is the government's top priority. The state is fully committed to ensuring that life-saving medicines such as vaccines remain easily available to all. Maryland is not alone in this stance. Massachusetts is adopting similar measures to safeguard vaccine access amid growing debates nationwide. On the other hand, Florida is moving in the opposite direction, poised to become the first state to completely eliminate school vaccine mandates. And this is the part most people miss. Amid all the policy shifts, the public opinion remains largely supportive of vaccines. In fact, a recent Harvard SSRS poll found that about 80% of U.S. consumers, adults believe children should be vaccinated to attend school, a testament to the enduring trust many Americans place in vaccines as critical tools for public health. Dr. Meena Seshamani, Maryland's Secretary of Health, reinforced this message by calling vaccines one of the most powerful public health tools we have to protect individuals and communities from disease outbreaks. As these developments unfold, the conversation about vaccine mandates and access is sure to ignite passionate debates. Are states like Maryland doing the right thing by expanding vaccine availability despite federal policy confusion? Or should there be a more unified, nationwide approach to avoid mixed messages and public skepticism? We invite you to share your thoughts and join this important discussion. Stay informed with the latest updates by signing up for daily news delivered directly to your inbox. Tadi Abeje, a freelance digital writer and editor for WTOP, brings stories to life with his deep-rooted passion for journalism. Growing up in Northern Virginia and born in Washington, D.C., Tadi loves telling the stories of people and communities, sharing their experiences with the world.